Community Spotlight on Z102.9.
Good morning. It's Community Spotlight on Z102.9, and I think we'll start our interview with the understatement of the year. It's been a heck of a year. We dealt with the pandemic and around Eastern Iowa, the derecho. That adds a lot of uncertainty to everybody, and mental health is something we do not want to joke about. That's very serious. 1 in 5 people affected by a mental health condition in the U.S. So let's get into the topic. Joining me this morning is Sarah Blader. She's a therapist with Eastern Iowa Health Center Behavioral Health. Sarah, good morning.
Good morning.
I know a lot of what you do remains confidential, but overall, tell me about what you've seen. What conditions really have you guys been focusing on during pandemic and post-derecho?
Well, with all the added stress and isolation with the pandemic and the sucker punch we got from the derecho, we've seen a lot of anxiety and depression that's been aggravated. Where people were previously able to manage their anxiety and depression, they're now needing help.
And when you look at what you do at Eastern Iowa Health Center, kind of take me through that. Those conditions and others, how do you guys offer help?
We offer help through looking at how people are resilient, their strengths, look at self-care, encourage them to not only look at their physical care, but their emotional, social, spiritual, and professional self-care.
Because really, it's important. We think of our body health, but mental health is a part of that. What are some of the cues, as I'm looking in the mirror every morning, that maybe I need to reach out to Eastern Iowa Health Center?
Well, definitely the cues would be if it's interfering with your daily life, your relationships, work, or sleep. If you see the bags under your eyes getting bigger and you're starting to get more stressed out, it might be time to seek some professional help.
And we've talked a little bit this morning about the pandemic and derecho, but just in general, what other types of phone calls do you see on a pretty regular basis?
We see a lot of phone calls on postpartum depression, relationship issues, chronic illness, coping skills, family conflict, and some various others.
And Sarah Blader, a therapist with Eastern Iowa Health Center Behavioral Health, those are all areas in which you and the staff there work on. I know a lot of people are hesitant when it comes to mental health. 1, they don't know where to start. And 2, I'm sure a lot of people don't quite know how the process works. What if I can't afford it? What if I can't pay for it? But the great thing about EIHC is you provide care regardless of ability to pay.
We have a sliding fee scale that's based on your income and your family size. We also take Medicaid and Medicare. And if need be, there's payment plans that are available as well.
So let's say, which is why we do these interviews, somebody's hearing us talk about this morning. It has inspired them to reach out, or maybe they know a family member and they're going to make sure someone is in contact with your organization. What are the next steps? Do people need to schedule an appointment next? Where should we send them?
Just give us a call at Eastern Iowa Health Center at 319-730-7300. We have 2 clinics with therapists at both, 1201 3rd Avenue Southeast and 4251 River Center Court Northeast.
Sarah Blader, our guest this morning, a therapist with Eastern Iowa Health Center Behavioral Health. Sarah, as we kind of turn the page on the seasons, we hope better weather means for better mental health and a bright outlook, but It's good to know that you guys are all there to help us when we need it.
Thank you.
Thanks for joining us this morning.
Goodbye.